We're back at 7:23. So the coronavirus pandemic is taking a toll on the mental health of all of us, right? Being on the front lines, though, especially, can be very, very difficult.
And so one mental health clinic in Camden County is now offering some help. So we are joined now by AJ Solomon, the co-founder of Harmony Bay Wellness, and Nancy McGregor, the clinical director. So first, good morning to both of you, and thank you for joining us.
Thanks for having us.
Of course. Well, how was this pandemic affected, and how has it affected the mental health of those who are on the front line and the public? If we could first start off with you, AJ.
Yeah, and I think Nancy's going to speak more to the support group that we put together, but I think we've seen increased levels of suicidality, depression, anxiety, also a lot of substance use disorder. There's been an increase in overdose. So I think it's been kind of holistically a pretty serious issue. And there's been a lot of press about it, but we're just trying to do our small part in our small area of the world to help out. So it's you know, I think it's going to get better, but it's going to take some work. So that's what we're trying to do. And we put together a support group for essential healthcare workers. So I'm going to let Nancy speak to that. But
yeah, Nancy, let's talk a little bit about that. These meetings, I think, are on Zoom to help with these healthcare workers and what they're dealing with. Is that correct?
They are on Zoom. We can really house a bunch of people in those meetings. And what we do know is that people who are doing the essential healthcare work, who are on the front lines, are really managing the anxiety and the fears of everybody else that they are working with. And what we want to make sure is that we provide a safe space for them to process some of the experiences that they're having. The groups are facilitated by a licensed professional. And also another big part of that support is hearing from other people having the same experience and be able to share that in a really safe space. We're hoping that by providing this as this is going on, we can help mitigate some of maybe the longer term effects of what it looks like when this is all over and everybody can come up for air. Because right now we know that people are going to work every day and pushing themselves and carrying all of this burden. And we want to provide some relief in the meantime in doing that work. It's exhausting, and we want people to know we're here for them and that other people are here for them and provide that place for that kind of processing to happen.
Sure.
Right, Nancy, and we love what you all are doing. This is a great idea. But Nancy, about how many people would you say have attended these meetings, and what's been the feedback so far?
So far, our meetings are growing. We've had about 10 to 15 in our last meeting, and what we are getting is that people are feeling a relief after being able to express themselves in this place and being able to know that people can really relate to experience they're having, and also identifying ways to kind of cope with it when they're not at work, and to be able to give each other feedback on things they can do to help kind of de-stress in the in-between time.
So we obviously know that there's a need there for these frontline workers, but obviously this is to either one of you. You guys are also offering some help to the public as well. Explain that.
Yeah, so I can take that one. So basically we decided we were going to open in the teeth of COVID, which you know, maybe wasn't the wisest decision from a business standpoint, but we did realize that there was a need for mental health care. And for the past year, we've been trying to develop a telehealth platform. So we're able to offer psychiatry, individual therapy, and even group therapy through our telehealth platform. So, you know, clearly people coming into the center isn't exactly the safest. It is an option, you know, but there's a lot of different safety approaches that we have to take. And so a lot of people have chosen to do their telehealth appointments, whether they, you know, just need psychiatry, just need individual therapy, family therapy. They've chosen to do that through our telehealth platform. So it's been pretty successful, and we have some appointments booked already. So hopefully more people reach out.
Yeah, I'm sure they will. And before we let you go, where can people go for more information?
They can go to our website, so harmonybaywellness.com. Look us up, give us a call if you need help. We're here to talk to anyone who needs it.
All right. Well, AJ, Nancy, thank you all for joining us. And again, we appreciate what you all are doing for us in the community.
Thanks a lot.
Thank you.
Well, still ahead.